Hey everybody, it's Bram Duffee here, back with Health Communication class. Happy to have you. This week we're talking about socio-cultural factors in health communication. You know, there are quite a few empirical studies out there that highlight how it's not just health determined by genetics or personal choices. There's a lot of other social and cultural factors that contribute to the overall health of people. So I just want to talk for a little bit about highlight stuff that came from the chapter this week. You know, there are factors out there that range from race and ethnicity to income and education level, really sex, even gender, among others. And each of these kinds of things play a significant role in the shaping of both health status and the health experience for different population groups. And so in our textbook, when you review Chapter 8, you'll notice that it has multiple studies about racial health disparities. And big deal topics come up, like people who are poor die earlier, or infant deaths for black babies are 2.4 times worse than for white babies, or the fact that tobacco use is the leading cause of preventable death, but smoking rates decline with increased income and education. So consider race and ethnicity, for example. Research indicates that racial and ethnic disparities in health are prevalent and often are due to systematic issues like discrimination and bias. These disparities can manifest in various ways, and really having access to quality health care and preventable stuff is part of it. But also what comes with that is the fact that there is a really interesting way of thinking about how a lot of different social determinants can come together at once to influence someone. And I think about even just here in Houston, how depending upon where you live will probably determine what hospital you go to or have access to. And, you know, not all hospitals are the same, and not all hospitals are able to provide the same, you know, level of care. And so it's just, it's frustrating because I see, you know, different examples about race and ethnicity playing a role, and that's part of our talk for this week, is because in one of the recent episodes that I recorded, you all know I do a podcast called EMS Research, and I had the honor of hosting Jamie Kennel, and he's not only a PhD researcher, but he's also a paramedic and holds a professor position at the Oregon Institute of Technology. And we had a really cool conversation that looked at his research into racial and ethnic disparities. And specifically, it was about pain management and how do ambulances treat pain for white folks versus black folks. It was just, you know, a pretty clear difference to see and understand that this was something that showed a strong racial disparity. And this is the deal. So he looked at research over, he took run reports over a long period of time, and was able to take into account a lot of different factors to make sure that none of the data was being skewed, and then was able to show that paramedics basically, for these really painful injuries like the long bone fracture, so it'd be like a femur or a humerus, like something that would be coarse painful and normally would get pain medicine, it just the research showed that black folks did not get pain medicine as often as white folks would. And so the discussion that we had was really engaging about that. And this report has really hit the industry pretty hard. I think that in emergency medical services in the United States, all of the major journals and podcasts, including mine, really covered this. And one of the things that I thought was interesting was that when they took an excerpt of his study and that they published that in the Journal of Emergency Medical Services, they were able to really describe most of the study, and it was part of the disparity. I noticed that some people would make comments saying that this isn't true or this can't be real, and what I found interesting was that, like, they don't base that on anything. So if you think about it, we have a researcher who has done research to look into this topic and write it up in an amazing way, and it's been peer reviewed by other researchers to review the study, and it's all written up for you to see. And then it seems like, this is what it seems like, someone just read the title or they read part of the abstract and then makes comments like, this can't be real because, or I don't think this could happen. And what's interesting is that these ridiculous comments that people make about the research are opinion based. And so you have an opinion based thing that gets connected to the article, and the article is like this weight of evidence that's showing you, and so I think it's really folks that are showing their ignorance or showing their racism, and maybe don't even know that that's what they're doing. But it's a very interesting topic because it is a time where it's a cool time to be able to learn about what was done for the research and to see that it's there, because a lot of folks think they live in their own bubble, right? They think racism isn't real when it comes to healthcare, or they think that that things are only a certain way in certain places. And this was really comprehensive, interesting research. So I want to set racism aside for a minute, but to of course highlight this as one of the major factors to discuss this week. The other things to bring up are not just the race and ethnicity, but also income. Income is a critical determinant of health, and people who have higher income levels typically correlate with better health outcomes. And so the reasons are multifaceted, because, if you have a greater income, it's going to allow you to have better access to healthcare services and nutritious food, safe housing, opportunities for physical activity. And so it's like, if you have the money when it comes to accessing health services, paying the premium or paying the copay for going to visit the doctor or the copay for the prescription may not be as big of a deal for you. Getting nutritious food may be a total different ballgame for someone who just can't afford that. And it's not just based on where they live; it's based on what you can do. And it's like really sad to see that there are issues like the fact that people can't afford to fix their health problems, and in the long run, it makes them have bigger, massive problems that cost a lot of money, cause them to be debilitated for a long period of time. And this is why I would say that I'm someone that likes to talk about having a healthcare system in the United States that allows, everyone to get covered. Because what happens is that we don't have a national system, so the burden ends up falling back onto hospitals and doctors that can't afford to offer this care. So it's concerning, because imagine this. Imagine you're a hospital that lives in a low-income area, or a hospital that's located in a low-income area. And that hospital will have to treat every patient that comes through the door. Some of the patients they might send by ambulance to a different hospital because they don't have the specific doctor specialty that they need. But overall, the lower income area is going to produce a payer mix. A payer mix meaning, this percentage of our patients are paying with insurance, this percentage of patients are paying with Medicare, these are paying with Medicaid, these are uninsured. So the payer mix might end up being all Medicaid and uninsured people. So somebody has to pay for that at the end of the day. And what happens is that a lot of times it's the doctors themselves or it's the hospitals themselves that take the hit. They don't, because they have to, they're obligated to provide the care. So even though the hospital has to provide the care, the patient doesn't have to provide insurance or payment, or these things are really something that cause a conflict. And so not having access can not just be the fact that I'm poor, so I don't have access. It's also maybe I live in a poor area, so the closest hospital that I go to doesn't have the same resources, and so there's a lot that can mix in with that. So, like I said before, this is a multifaceted kind of thing. Education level is another key variable. People that have a higher educational attainment generally are healthier people. I don't know about you, but I got through high school taking a health class, and in college I had to take a PE and a health class. And so it's not just that you're exposed to it, but it's also that you're developing critical thinking skills about these things. And so we talk a lot about theory in school and helping prepare someone to apply that theory. And so having education gets you there. And overall, it helps people be able to promote good health. I would say that one of the benefits of education for an elite group of people is that they get to experience school without the kinds of stress and craziness that others don't. And so think about how you can go to school and focus on your studies and not think about anything of concern, because everything is provided for you. Your education is maybe where you live on campus and you have full access to fulfill the needs of food and sleep and sex and working out and anything that you need. And so because those things are so readily available for you and set up for you like on a platter, it means that you are now prepared to think about higher order level of things like schooling and the things that you're studying in school. And so that kind of education experience is remarkable because it allows folks to be able to experience things and have a different kind of preparation. So some of it is not being in the running mix of things, right? So if you're not I have a hamster over here by my desk. If you're not in the rat race, if you're not on that hamster wheel going because you're in a position to be able to look back and see things that are happening from different perspectives, it really helps. There is a difference in the kinds of things that happen to you as a student when you are a full-time worker and going to school versus just going to school. And I can just tell you that for myself, I've always worked full-time and gone to school. And I think that the only reason that I made it all work is because I just worked really, really hard. But it also meant that I didn't get the same time to reflect and think and enjoy. And so your education experience and level that and how that helps prepare you for the next step, all that's interconnected. The other thing is that sex and gender also really contribute to health disparities, because women face unique health challenges and are sometimes susceptible to certain diseases at certain times of their life. And men are in the same boat, sometimes susceptible to certain diseases at certain times of their lives. And there are really interesting things like, maybe men might be less likely to seek preventative care or address concerns promptly. And these kinds of trends that we see are really interesting, because one of the things that we try to do in health communication is we want to understand all of these groups better so that we can target them with messages to help them with these obstacles. And it also is a topic that's really difficult to talk about in a way that doesn't involve the mention of health insurance and the need for figuring out how we're going to pay for things. Because, it's important to not be political about topics nowadays, because as soon as we do, we just start throwing out the issue, saying the polar opposites of the issue. And I'm just here to say it's a bad issue that we have to fix, because it does overall hurt our country and our people, and it doesn't matter your race, background, income, education, these things that I talked about today, that are usually compounded and made more interesting by people's circumstances. But overall, there are things that we can do legislatively to make this better. So hopefully down the road that will happen, and then shift a lot of the pain off to the off of the patient in different ways. All right, it was great talking to you today, and I look forward to seeing you in the discussion board as we continue the topic. See you soon.